Sunscreens are used to protect the skin from the harmful effects of the sun, such as sunburn, premature aging, and the risk of skin cancer. They can also help decrease the risk of sunburn-like skin reactions caused by certain medications. The active ingredients in sunscreens work by either absorbing the sun's ultraviolet radiation or by reflecting it. It's important to note that wearing sunscreen does not mean you can stay out longer in the sun, as they cannot protect against all of the sun's radiation. There are various types of sunscreens available in many forms, such as cream, lotion, gel, stick, spray, and lip balm. When using sunscreen, it's important to follow the directions on the product package. Apply the sunscreen generously to all exposed skin 30 minutes before sun exposure, using about 1 ounce to cover your entire body. Remember to reapply after swimming, sweating, or drying off with a towel, and reapply every 2 hours if you're outside for long periods. If using the lip balm form, only apply to the lips. If using the spray form, be cautious as it is flammable. Avoid smoking when applying and keep it away from heat or open flame. When applying sunscreen to the face, be careful to avoid getting it in your eyes, and rinse thoroughly with water if it does. Use cautiously or avoid use on irritated skin. It's best not to use sunscreen on infants younger than 6 months, unless directed by a doctor. It's recommended for infants to stay out of the sun and wear protective clothing when outdoors. If you develop a serious sunburn or think you may have a serious medical problem, seek medical help immediately. Some sunscreen products may cause clothing staining and can make the skin more sensitive. If you experience redness or irritation, discontinue use and consult a doctor or pharmacist for an alternative sunscreen. If prescribed by a doctor, the benefits of using this medication outweigh the potential side effects. Serious allergic reactions are rare, but seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so consult your doctor or pharmacist for any concerns. If you experience any side effects, you can report them to the FDA in the US or Health Canada. Before applying this SPF 30 lotion, it's important to let your doctor or pharmacist know if you have any allergies to its ingredients such as aminobenzoic acid/PABA, benzocaine, tetracaine, sulfa drugs, or any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's best to talk to your pharmacist for more details before use. When using homosalate maratomatoxinoxatoxycrylene zinc oxide SPF 30 lotion, it's important to be aware of potential drug interactions. These interactions can affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If this lotion is accidentally swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical attention. You can call 911 for emergency help, or contact a poison control center for assistance. If you're in the US, you can reach out to your local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center for guidance. The sun emits 2 types of ultraviolet, UV, radiation that can cause skin damage, premature aging, and increase the risk of skin cancer. UVA radiation can also cause skin reactions to medications and other chemicals, while UVB radiation causes sunburn. Most sunscreens protect against UVB radiation, but it's important to choose a sunscreen that also protects against UVA radiation, broad-spectrum coverage. Look for ingredients like avobenzone, octocrylene, titanium dioxide, zinc oxide, and benzophenones such as oxybenzone. When choosing a sunscreen, look for a sun protection factor, SPF, of at least 15, with SPF 30 providing high protection against sunburn. The FDA recommends reapplying water-resistant sunscreen as often as necessary, especially after 40 minutes of water activity or sweating. Remember that water, sand, and snow can reflect the sun's radiation, so it's important to protect yourself with sunscreen in these surroundings. Even on cloudy days, the sun's radiation is still present, so don't forget to apply sunscreen and wear protective clothing when outdoors. Additionally, try to avoid prolonged sun exposure, especially between 10 a.m. to 4 p.m. when the sun's radiation is at its strongest. When you're spending time outside, it's important to apply sunscreen generously and frequently to protect your skin from the sun's harmful rays. This SPF 30 lotion, which contains homosalate, miratamate, octinoxate, octocrylene, and zinc oxide, can help provide protection from both UVA and UVB rays. It's recommended to apply this lotion at least 15 minutes before going outside, and to reapply it every 2 hours or after swimming or sweating. This can help ensure that your skin stays protected throughout the day. Remember to store this lotion at room temperature, away from heat and light. Check the storage information on the package and do not use it after the expiration date. If there's no expiration date, it's best to replace your sunscreen every year as it may lose its ability to protect you from the sun over time. Keep this product away from children and pets. And when you need to discard it, do not flush it down the toilet or pour it into a drain. Instead, consult your pharmacist or local waste disposal company for proper disposal instructions. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.